morning, everyone. My name is Valerie and my student number is 23010. And I'm gonna discuss two conditions which is very common in New Zealand today. One is cold sore and another one is sore throat. But first, I'm gonna discuss about sore throat. So, sore throat is a painful dry irritation of the throat and causes difficulty in swallowing. There are different types of sore throat depending on which part of the throat is affected. So we've got pharyngitis, which is inflammation of the pharynx, which is located at the back of the mouth between the tonsils and the larynx. And we've got tonsillitis, which is inflammation of the tonsils, and laryngitis, which is inflammation of the larynx, which is known also as the voice box. What is the New Zealand relevance of sore throat? So, in New Zealand, sore throat is one of the top 10 complaints while New Zealanders are visiting their GPs. Why? Because in New Zealand, the Maori and Pacific population ages 3 to 35 years old are high risk of getting rheumatic fever. So rheumatic fever is caused by strep throat that is untreated. And they actually advise from this population to do a throat swab just to rule out strep throat. Pathophysiology of sore throat. So the virus or bacteria invades the pharyngeal mucosal tissue by producing various proteases and cytolysins, causing inflammation or irritation in the throat. And there are different causes of sore throat. One is virus, which is associated with viral infections like cold and flu. This one can go away untreated, and some of the symptoms of this are also the same with the symptoms of having cold and flu. Second one is bacteria. So there are different types of bacteria that can cause sore throat, but the main one is from Streptococcus pyogenes, which is the group A Streptococcus. Second one is allergies. So how does allergies causes sore throat? So when the body reacts to an allergy, triggers, it releases histamine. So this histamine causes symptoms like nasal congestion. So from that, it results in a postnasal drip, which is a buildup of mucus at the back of your throat. And another cause is irritation from dry air. So from dry air, it sucks the moisture from the mouth to the throat, causing scratchy or raspy voice. And chemicals like the one we use for cleaning and for those who are working at painting jobs. Next one are symptoms visible for those who have sore throat. We have painful or scratchy, difficulty swallowing, redness at the back of your throat, swollen neck glands, and cold and flu symptoms. But for the cold and flu symptoms, it is not visible for those who are having strep throat caused by a bacteria. As I mentioned a while ago, bacteria is one of the causes of sore throat, and this one causes strep throat. So strep throat is a kind of sore throat that is caused by bacteria from group A Streptococcus. It usually affect age 3 to 14 years old, mainly during winter season, and those who are living in low socioeconomic places. Very contagious, and if it's left untreated, it causes rheumatic fever, which is a serious illness or an inflammation that can cause damage to the heart or the kidney. Aside from the symptoms I have mentioned earlier, if you have a strep throat, people also feel feverish or having headache. They also have enlarged tonsils and covered with white stuff like a pus-like, and they also feel nauseous and vomiting. first of sore throat. So one is age. So children and teens are more susceptible in getting sore throat, specifically age 3 to 14 years old. Why? Because children haven't built up their immune system like how we adults are, and they are more exposed in the environment, like those who are going to kindies or schools or in their surroundings in the family if someone is smoking or have colds and flus. Next one is lifestyle. So smoking, secondhand smoking, common household irritants like the one we use for cleaning, and those whose jobs are like for gardening, the one they use for pesticides and all. Treatment for sore throat. So there are different sort of treatment used and available in the market, and usually like the lozenges, throat sprays, and gargles, they contain 2 to 3 classifications of drugs. So some of the classifications used are, we've got antiseptic or antibacterial, which reduces or kills bacteria in the throat. So it includes chlorhexidine, povidone iodine, like chlorbenzyl alcohol, cetylpyridine, and amoxicillin and penicillin. As written here, is used for strep throat, but it's a prescription-only medicine. And then we've got anti-inflammatory local-acting medications, which is benzidamine available or usually seen on lozenges, and we've got anesthetic, which used to numb the pain. Examples are benzocaine and bupivacaine. So here are some of the examples of the available lozenges, gargles in the market. So they are usually containing either 2 antibacterials, or one is anti-inflammatory, or the other one is antibacterial. Other sorts of treatment used is analgesic, which is used for if they have fever or pain, non-steroidals, NSAIDs, which is used in reducing inflammation. We've got ibuprofen, aspirin, and chlorpheniramine. What are the things to do to prevent having sore throat? So practice coughing at the crook of your elbows. But if you accidentally use your hands when sneezing, then you have to wash your hands immediately. Wash your hands before preparing food, since strep throat is a contagious one, so avoid close contact with people who you think have cold and flu symptoms or upper respiratory infections, and avoid smoking as much as possible if you can. Okay, my next topic is all about cold sore. So cold sore is a small fluid-filled blisters that appears on the skin, usually on the lips, the chin, the cheek, or the nostrils. It is transmitted through physical contact and commonly caused by herpes simplex virus 2. So there are 2 types of herpes simplex virus 2. Type 1 is associated mainly for facial herpes, which is cold sore, and type 2 is associated for genital and rectal infections. Before I go to the pathophysiology of cold sore, actually in New Zealand, cold sore is one of the reason people were checking or going to the pharmacist during winter seasons or summer seasons. One of the reason is the weather, as we have like the skin condition for the eczema, so because of the humidity, which is it dries out the moisture content. Okay, pathophysiology of cold sore comes in 4 stages. So the first one is the tingling sensation at the affected area. So this one, a virus already invades the cell membrane or the outer layer of the skin, which is we call the epidermis. Stage 2 is the blister formation, or there is already a slight swelling. It appears after 48 hours of having the tingling sensation or the burning sensation on the lips, or any lips, chin, or any parts of the face. And stage 3 is what we call the weeping stage. So blisters started to burst and form clusters leaving fluid-filled sores. And fourth stage is the healing stage. So the sores already dry up, scalp formation, and starting to heal. Triggering factors for cold sore are stress, fatigue, exposure to sunlight or wind, hormonal change, or weak immune system. But for the stress and the fatigue, actually it's equals to results with weak immune system. Risk factors are, one is age. So actually, as per survey of the World Health Organization year 2016, people whose age are below 50 years old are already acquired herpes simplex virus 1 during infancy or childhood due to the people surrounding them. So since herpes simplex virus is dormant, so there's a tendency to be reoccurring due to the triggers I have mentioned a while ago. So infants and young children up to 3 years old have higher risk of being exposed to herpes simplex virus 1 because of their environment. And second one is lifestyle. So under lifestyle, it includes our daily routines, like those who are working too hard or those who exert too much in working out. So being workaholic and excessive workout can drain you physically, emotionally, or mentally. So you can help it. Your immune system goes down. Treatments for cold sore. Actually, there's no treatment that can really eradicate or cure the cause of cold sore. This is a dormant type of virus in the body. So it can be the symptoms can be prevented, but the virus will still stay there. So some of the treatments available are antiviral agents, which prevents the virus from multiplying, and it reduces the severity and duration of the symptoms. So it comes into two preparations. You've got the topical ones and the oral ones. So for the topical, we've got the acyclovir, and example of this is Zovirax. We've got the penciclovir, which is a pharmacist-only medicine. I think it is Viratac over the, if you buy it in the pharmacy. And then oral ones is famciclovir. So famciclovir, the packaging comes with 3 tablets, but it equivalent to 1 dose only. And then you've got protective and healing plasters as well, which is the Comfit for an example of that. So those are some of the examples of treatments for cold sores available in the pharmacy. Prevention for cold sores. So one is using lip balm containing sunblock or zinc oxide before going out to protect your lips. But if you have already the cold sore, so then precaution is a must, like avoid physical contact with others, especially kissing babies, because this one can lead to neonatal herpes. Avoid touching a cold sore unless applying a cream. And after applying, make sure to wash your hands immediately and avoid touching any parts of your body. And do relaxation technique like deep breathing, exercise, and meditation if the cause of cold sore is due to stress. And that's it for today.
Thank you, Valerie. So for your
Sore throat treatments, it's good you covered majority of them.
Yeah.
but if someone can't afford any of those, do you have any
Household remedy or any herbs that you can ask them to use?
Sorry.
If someone does not want to use any of the medication,